So I'm David Cosio. I am the pain psychologist at the Jesse Brown VA Medical Center. I am part of their outpatient pain management program, but I also participate in the CARF-accredited interdisciplinary pain management program. When approaching a patient and deciding whether they should be someone who you could consider opioid trial with, we recommend a couple of things. CDC recently came out with their guidelines, and some of the things that I'm going to recommend are going to be similar to what their outlines are saying. But basically, we want to start off, making sure that we are doing a thorough evaluation of the patients that we are considering for opioid therapy. And this includes not only a psychological evaluation, but an evaluation of any kind of substance use disorder. We know that patients who have a history of substance use disorder or current substance use disorder are going to have more likely a problem with using their opioid medications. And so, we recommend that you get a past history, a current evaluation of their current use of substance use. Some of the criteria that we use for substance use disorder have changed recently due to the new APA DSM-5 diagnoses. So you want to make sure you're using up-to-date assessment tools. In addition to that, you can use other types of tools that we use. So for example, a decision tree. Most systems, healthcare systems, will have a several-page decision tree, and so you want to make sure that you're familiar with that process. But some other tools might be an opioid pain agreement, doing random urine tox screens. You might also consider using an opioid risk tool. I'm a little bit impartial with the SOAP, which is a good risk tool. You want to look into your state's prescription monitoring database and the neighboring states of the state that you practice in. And then you also want to make sure you're providing some education to your patients about the difference between acute and chronic pain management. And using those tools might help guide you make a better decision on who to start an opioid trial with.